All right, Joe, you opened up your Inside Tucson.
You do that.
Your Inside Tucson business here.
So I get every once in a while you let me talk healthcare. You know what I mean? Because I'm a CEO in the healthcare field. I do medical research. I run. I am in it, man.
Well, now bill number 2 is waiting on the line. You going to talk about
not
healthcare?
Testosterone. We're not going to talk about diabetes. We're not going to go healthcare. Healthcare. I'm going to talk about the business of healthcare. I live it, and I devour information, political, economic, business, because I have to understand, because I run a business, and I have a lot of people I'm responsible for.
The latest cast changes on Glee.
I got to know this stuff, guys, because I got to know how to plan for it. And I meet other CEOs of other healthcare organizations, large and small, and I ask them, what do you think? And no one has a clue how to do it. You know what I mean? That's what's killing me. Like, do I buy the $2 million MRI machine? Do I expand and open the new business? I don't know, because I don't know what the future boogeyman's coming out of the dang box. So I'm in it. I live it.
Yep.
Let me weave to you 3 stories. We're going to cap it off with the one that you've got in front of you, right? So, editorial in the paper this morning from one of the other around the world said basically Kathleen Sebelius, she's had 3.5 years to prepare for their and it's a complete mess up. She should be fired. In the private sector, you would be fired if you had this kind of rollout and this kind of woman. So what does she do? She tries to go out and Jon Stewart and kind of do the mea culpa, and Jon skewers her and eats her alive. Says basically, dude, am I dumb or what? I mean, this is a complete mess up. And if this debt ceiling thing were not going on, this would be the talk of the town.
Yeah,
how broken this
and the timing of this with
is.
the Republicans has been interesting, because if you didn't do what you did now and let Obamacare just kind of happen and be front and center, and all you did was showcase how crappy it is, you'd be making better political points for re-election than you ever did before. Well, it's a
10-day shutdown, so they're going to punt the thing for 6 weeks. So there'll be the time to have a talk about this. So, Chris, the cost originally budgeted of the healthcare.gov process, which is broken, still doesn't work. I've been on it many times trying to figure out how this thing works, because, again, I got to figure it out. The original cost was supposed to be $93 million to build the website. It ended up costing $643 million. 400% more, Chris. 400% more. Guess what? Guess who they hired to build healthcare.gov? A company called Booz Allen. Booz Allen and something. H starts with an H. Hamilton. Booz Allen Hamilton they have $3.9 billion in government contracts that they currently have under. I've looked at their donations. They've given money all over the place. $15,000 to Republican George Bush, $51,000 to Governor Romney. Guess who their biggest contributor is in the 2012 election? The lion's share of the money they donated back to the government was $176,000 to the president, Barack Obama, in 2012. And then they get the contract to build a 400% over budget website that doesn't work. This is what's coming to healthcare, folks.
It's like Rio Nuevo.
This is what's coming to health. I'm going to give you the third little story in a myriad of things. Okay, Britain. They have this thing called National Health System. It's their Obamacare single-payer system. They've had it for 60 years. If you want to know where we're going, go to uktelegraph.com and just Google National Health System. You will see bureaucracy, not being able to have access to care, lack of technology, just a complete, absolute mess. So guess where they're going to go to look for solutions? They're starting to say now, after 60 years of having a national payer system, hey, maybe the private sector healthcare insurances and the private sector groups can help us evolve out of this quagmire we're in. They're looking at, listen to this, they're looking at the countries such as India, Ghana, and Mexico to see how to introduce into the UK system in order to make the national health system more efficient. They're going to Mexico and Ghana to figure out how to fix a single-payer system. And what are we doing?
We're going in single-payer system.
Please read this editorial from Inside Tucson Business for me, would you?
Well,
brand new editor.
Yeah, Mark Evans, formerly of The Citizen and Explorer newspaper for that. He's right opposite of the Christy Simone trio, and how the people in the room will never follow Michael Crow's advice on how to change a society. But he talks about, let's get to the end, because this is the best part of it. He talks about there's no question it'd be a boon to American business if we went for, Medicare for all would be good for business.
So this is the argument for the single-payer system, to have everything under the government, like the VA system. Let's compare it to the VA system. Very similar to that model.
Some of the savings would be eaten up by the new Medicare tax, but that tax would be spread among all Americans, meaning employers would see significant savings just in the absent subsidy alone. American hospitals and doctors' offices spend billions on staff and technology to keep track of all their insurance plans, patients, filling out forms, fighting with insurance companies to get paid. All of that goes away with single payer. Those savings would more than offset the tax to pay for it. Obamacare could save American employers billions. Medicare for all would save it $1 trillion. That's a lot of potential profit, and isn't that what it's all about? Well, what does he ignore, Joe?
The fact that the businesses have a moral responsibility to their employees, they have a moral response to their community, the fact that
Who's paying for this? So he says there's $1 trillion that the companies are paying in subsidies to their employees, right? So now they're not going to have to pay for it. Somebody has to be paid. So not only do you have to pick up all the money to pay for the subsidies anyway for the employees to pay for their health insurance, all the people that we've talked about that don't have health insurance, you got to pay for them too.
Right.
So the cost actually, so here's the thing. So this is being done through private insurance companies. So now he's saying that somehow the U.S. government is going to run healthcare more efficiently than private sector.
Right. And to Dylan Radigan's point, for 20 years, this problem has been percolating. We do not have a free market system, healthcare system. It's all regulated like crazy. I'm an entrepreneur. I look for the edges and I look for the opportunities in big, complex markets like Medicare, medical. I'll find one and I'll call my attorney and he says, oh, can't do that. Anti-kickback, anti-Stark, anti-this, anti-that, that regulation, this state regulation. It is the overregulated complete pig that makes sure that the people at the trough are continuing to get their gravy train.
Yeah.
You start injecting real, true economic forces and unleash the entrepreneurs on this marketplace, you will see massive things start happening. Put this patient more in responsibility for their out-of-pocket stuff, so they have to ask the dang question, geez, how much is this going to cost me, doctor? Not a $5 copay.
I agree.
All this stuff is basic stuff that we've allowed for 20 years to continue on this.
I mean, this is a pretty big column. I mean, he wrote like 1,200 words on this thing, and he doesn't mention that there's a taxation consequence to paying for all these people.
So what will happen, folks, is as this continues to move towards single payer, you pay FICA, F-I-C-A, federal withholding, all that stuff. You're going to have a third one come in there, and it's going to be called Obamacare. It'll start out at 2% of your withholding. The employer will pay 2%, you'll pay 2%. Then it's going to go to 4%, then 8 and 8 and 10 to 10, and it's going to become this big, fat, big piece that you're handing over to someone in the federal government to then come backwards and tell you what you can and can't have from your medical
Do I think insurance companies are the greatest entities in the way they run their business? No. Okay. But there are so many private market ways to fix this. We've talked about it ad nauseum for years.
No one's talking about that. To Dylan's point, guys, if you want smaller government, you want this fixed, make it better. Get out of the way. Stop over-regulating it. Let unleash the entrepreneurs. They will figure this out. Private market, free market is the best delivery of goods and services. We do not have a private market healthcare system as it is. It's this quasi-weird fascist, give me money and I give you the plug.
And you got to remember, this is the same company that owns owns Tucson Weekly. And this looks like more of something that should be in the Tucson Weekly. You cannot go into your maybe it's typical of Tucson business. This is what's great about Tucson business. This is why we're such an interesting mental institution case here in the world of Tucson business.
And dude, I would love to have this debate on air. Mark, come on, let's go. I mean, I'm locked and loaded for this one. This is as your first editorial out of the gate to call for a single payer system in America inside Tucson business is a shame.
Why don't you have Dan Gibson write it from the Weekly? It would have been better.
Shame.
So, all right, let's go to the phones real quick. Let's go to Billy number 2. Billy, what's shaking, bud?
We owe $70 trillion.
I understand that, but
to walk out a $4 trillion solution, which is basically just a way for the Democrats to avoid dealing with this until 2017. I'm not here to talk about plans to deal with this till 2017. I'm saying we've got a real problem, and I'm tired of Republicans and Democrats who either want Republicans who want to burn the place to the ground, and Democrats, with all due respect, who want to offer a plan that gets it through their end of their second term of their presidency, and then screws me and my kids when it's over. And until we do that, we have to deal with the extraction that is at foot. It is the reason the financial markets are behaving the way they're behaving. That is a mathematical fact. This is not some opinion. This is a mathematical fact. Tens of trillions of dollars are being extracted from the United States of America. Democrats aren't doing it. Republicans are not doing it. An entire integrated system, financial system, trading system, taxing system that was created by both parties over a period of 2 decades is at work on our entire country right now. And we're sitting here arguing about whether we should do the $4 trillion plan that kicks the can down the road for the president for 2017 or burn the place to the ground, both of which are reckless, irresponsible, and stupid. And the fact of the matter is, until we actually, and I'm sorry to lose my temper, but I tell you what, I've been coming on TV for 3 years doing this. And the fact of the matter is that there's a refusal on both the Democratic and the Republican side of the aisle to acknowledge the mathematical problem, which is that the United States of America is being extracted. It's being extracted through banking, it's being extracted through trade, and it's being extracted through taxation. And there's not a single politician that has stepped forward afford, Susan, to deal with this.
But there's only one right now. The leader of the free world, whether you like it or not, the President of the United States is arguably one of the most powerful individuals we have out there.
But
and
Susan,
he's
what you're saying is exactly the point that Dylan is making. It's not about one guy. It's about all of them.
No, I actually disagree. I think Dylan's saying it isn't about one guy.
It is about one guy.
What would you like him to do?
I would like him to go to the people of the United States of America and say, people of the United States of America, your Congress is bought. Your Congress is incapable of making legislation on health care, banking, trade, or taxes, because if they do it, they will lose their political funding and they won't do it. But I'm the President of the United States, and I won't have a country that is run by a bought Congress. So I'm not going to work with a bought Congress and try to be Mr. Big Guy. I'm working with the bought Congress. I'm going to abandon the bought Congress like Teddy Roosevelt did, and I'm going to go to the people of the United States and I'm going to say, you've got a bought Congress. And until we get rid of the bought Congress, which is Jimmy Williams' constant point, which is get the money out of politics, and until a president says that's the problem and says he's going to fix it, there is no policy that I can possibly see, no matter how brilliant your idea may be, or your idea, or my idea, or her idea, or your idea at home, is that idea will not happen as long as there's the capacity to basically fire a politician who disagrees with me by taking funding away from him. Is that a fair assessment?
Money in politics is the root of all political evil. It is corruption at its worst. And until we step up and kick that out of the park, it's going to be the same system all
and only the president could do that. We're going to
No. The Congress has to do it too. The Congress has to do it too.
But I'll tell you what. How bad does it have to get? How much money has to be extracted? How many things have to be heard?
Down to brass tacks. Okay, physically, what do? You go
and give a speech
right now.
Right now.
Right now.
You say.
And then what happens tomorrow?
Tomorrow, what happens is you begin the process of actually investing in solving the problem. So I come out and I say, how? I create an infrastructure bank with 2% blending immediately. Once I explain to people the problem, once I explain to you have cancer, once you understand how screwed up your trade, tax, and banking policies are, believe me, you will have no issue when I incorporate an infrastructure bank that I fund with repatriated offshore money that I bring in and then use to create 2% direct lending to every business in America. Because when you realize that the banking system is fully corrupt and defrauding us, and I come out and say that, which is what I want my president to do, that at that exact moment I say, you know what, we got a screwed up situation here, people. You all know it, and now what? I'm going to admit it. And as a result, not only have I admitted it, but we're going to begin the process of solving it like grown-ups. They did it in World War II. They did it after the Civil War. They did it in Latin America with the Brady bonds. We are not seeing it happen now. The panel stays a little more emotional than I anticipated getting at work this afternoon, but what am I going to do?